Hello, everybody. Welcome to the Healthy Joints, Healthy Lifestyle Show. For those who don't know me, my name is Dr. Arinola Dada. I help people with autoimmune diseases get their immune system back on track and people with joint pain become pain-free. Today, we're going to talk about Sjogren's. It's like SJO, Sjogren's, Grens. And it is an autoimmune condition that presents with dryness in the mouth and dryness in the eyes, right? And so you're wondering, who gets this condition, right? So most autoimmune diseases, unfortunately, are more common in women than men, but can affect anybody of any age, right? And so what happens is that the immune system causes attacks the lacrimal glands, the tear ducts, and also attacks kind of the salivary glands. So people with Sjogren's, although they have dry eyes and dry mouth, it can be where, and dry eyes is described, tell people it's like kind of like feeling like you have sandpaper instead of eyelids, right? It feels gritty, like you have sand in them. And then dry mouth, where it can make you feel like your mouth is full of cotton. It's difficult to speak and also to swallow. So although that dry eyes and dry mouth is the most common presentation, there are other things that are associated with Sjogren's that sometimes brings them into the rheumatologist's office. So here we go. Joint pain. So some people can have joint pain and stiffness. Some people may actually have swelling in their salivary glands, right? And that is usually kind of below the jaw. And sometimes in front of your ears is that area where you can feel that salivary glands or parotid gland. Some people actually have vaginal dryness. So it's dryness everywhere. And because there's so much dryness, there can be cough. If there's vaginal dryness, obviously there may be painful sexual intercourse. And some people have just prolonged fatigue from Sjogren's, right? So it's an autoimmune disease where the immune system mistakenly kind of attacks the body's own organs and cells. So I describe to patients, what is an autoimmune? Why do people get an autoimmune disease? So the immune system is there to protect us. So I think of the immune system as the body's protection. So if the body was a country, you have the police, right? And you also have the military, right? So if we think about the military have been the might, so that would be the immune system. So when there are invaders into the country, the military is supposed to protect the country. So same thing for the immune system. When there's invaders into the body's immune system protects us. So it's fine when it is doing what it's supposed to do. So when there's bacterial, viral infections, the immune system protects us. Otherwise, it's a minefield out there if we don't have an immune system. Sometimes there is confusion. And the immune system, instead of protecting us, starts to attack different parts of our body. And when it does that, in Sjogren's syndrome, it's typically the salivary glands as well as the lacrimal glands. People don't really know why people may develop Sjogren's syndrome. Certain genes, so it may run in families, but sometimes there is a triggering mechanism or an infection or a particular bacteria that may trigger it. But that is still, there's a lot of research going into why we develop Sjogren's. So we've talked about the symptoms already, but certain organs may be at risk when a person has Sjogren's. So obviously the dryness in the eyes is not good for the health of the cornea. Dry mouth, it result in cavities. But other than that, there's also the possibility of ongoing joint issues, thyroid issues. The kidneys can be involved in people with Sjogren's. People with Sjogren's can have unusual lung scarring and may actually have problems with their nerves, where they may have things like peripheral neuropathy. Sometimes Sjogren's actually doesn't occur on its own. It may also occur kind of with other autoimmune disease. So it's very common that Sjogren's can occur with lupus or with rheumatoid arthritis. Okay. Sometimes people kind of say, we talked a little bit about some of the complications kind of with dental cavities, right? So if you have dry mouth, the saliva has antibacterial properties. So if you're not even kind of able to kind of bathe the oral cavity with saliva, then it results in accelerated dental cavities. yeast infections, right? So if you have dry mouth, you may be more prone to thrush in the mouth. And then visual problems, if you have dry eyes consistently, like I said, you can have some corneal aberrations and problems with vision. Less commonly, we talked about scarring in the lungs, abnormal lymph nodes. People with Sjogren's may actually be prone to a condition called lymphoma, which is a tumor of the lymph node. Not common, but something that our patients with Sjogren's, we're monitoring them to try to make sure that if anything pops up, we have an early start. And then some people can have peripheral neuropathy, which is difficult to treat, but at least they understand where it could be coming from. So typically your doctor would probably be running some blood tests, kind of look at the different blood cells, kind of to make the diagnosis, we'll run a ANA test and run subsets of this called an SSA and SSB antibodies. These are antibodies typically associated with Sjogren's. And your doctor will also kind of check things like a sedimentation rate, a CRP, and kind of make sure your liver and kidneys are all working well. The next thing is I work very closely with ophthalmologists, that's your eye specialist, to kind of determine how dry the eye is. Do they need to have like plugs to kind of make sure there's increased eye moisture? And sometimes we use even artificial tears. We want to make sure that there is no ulceration or any damage to the cornea or the covering of the eye. Some in the past we would do things like salivary gland biopsies, but really have not done that recently unless I think there's something else going on. Chest x-rays would be helpful, and sometimes if there's a lymph node, you kind of want to do a biopsy of that just to kind of make sure that it's not becoming like a lymphoma, a tumor of the lymph node. The treatment for Sjogren's, though, there's a lot of clinical research, and at the time of this video, we are actually involved in clinical studies for patients with Sjogren's, but they typically are limited treatments at this time, and it's usually based on the symptoms. So if there's inflammation in the eyes, there are medications like eye drops and medications like Restasis, which is like just to use a generic term, it's a cyclosporine eye drops, which really helps to reduce the inflammation in the eye. What about increasing saliva production? We use medications like Salagin or Evosac to increase the saliva production. But some of the side effects from the saliva production medications is that, well, it makes everything else moist. So people may have sweating, abdominal pain, or sensation of flushing, and sometimes even like increased urination, right? So if there's arthritis, then your doctor will have to talk to you about that and kind of also make sure that you're not developing like rheumatoid arthritis, right? And then your doctor may also kind of say maybe a medication called hydroxychloroquine, which we use in general to prevent autoimmune disease from getting worse, may be an option. Right. So ophthalmologists sometimes can use like, help to drain the tears or seal the tear ducts that would otherwise kind of drain out the tears very quickly. And so that helps to kind of make sure that there's enough of a lubricant in the eye. So we typically work very closely with ophthalmologists. So I hope this has been helpful to patients trying to understand what is Sjogren's, who's at risk for Sjogren's, what is the manifestations of Sjogren's, and then what are the potential treatments? So my name is Dr. Arinola Dada. If you're in the greater Seattle area, find us at Overlake Arthritis and Osteoporosis. We have an army of people that are there to help you through your autoimmune disease. We are all living longer and longer. And so one of our goals is to make sure that our patients have an amazing quality of life. We're also involved in clinical trials. At any given time, there are a number of trials running, and we really encourage patients to participate, not just for their own personal well-being, but also because we need to work together as a community so that we can get cures to a lot of these autoimmune diseases that we're dealing with. Autoimmune diseases are on the rise, but we're also living longer and longer. So how can we work together with people in our community so that we can get those outcomes and those results that improve our quality of life and find cures for autoimmune diseases? Thank you so much for listening. Take good care.